good evening, good evening, everyone. Good evening, good evening. How is everybody doing today? And we appreciate you taking your time out of your busy schedule to join us here on Health Talk today. Right. So we do appreciate you, as I said, for taking time out of your busy schedule to just join us here on Health Talk on tonight. We are super excited to have you with us. Uh, we have a somewhat of an interest topic that we want to discuss, talk about on tonight. So go ahead and tag somebody and let them know that Health Talk is on the line, and let them know that we've got some good, heated discussion to talk about. It's a very interesting topic to discuss this evening. So, yeah, that's what we're doing tonight. And thank you again, as I say, for taking time out of your schedule to, just join us here on tonight. We don't plan on being here long. We kind of got a little storm going on here, so my thing is cutting in and out, so I do apologize about that. But nonetheless, we're going to go ahead and get started with our podcast and hope that we can continue to go on without having any further interruption. Again, welcome to Health Talk. And this is the podcast where we explore um, what matters the most to everybody, and that is our health and well being. I am your host, Dr. Corbett. I'm also the program director for Cares Training and Education Center, and along with Dr. Deidre Willis. We appreciate you taking time out of your busy schedule to join us here on Health Talk on tonight. And today we're going to be diving into a topic close that's close to home for everyone. That's all of us, no matter where we live, no matter what we do. The topic that we're going to be discussing tonight um, is of importance to us all, and we appreciate you taking the time to come in to listen to us on tonight here on this podcast. All right. But before we actually get into the meat of the podcast, we do want to make a couple of quick, brief announcements, and then after these announcements, we're going to go ahead and dive into the podcast for tonight. One of the announcements we want to take this opportunity to talk to you about is to encourage and invite you to go over to Amazon or Barnes and Noble and check out the books that we have available. I'm sure that there is something that each and every one of you will be find very interesting and find very useful. So, if you will, just take a few moments of your time to go and check out Amazon and Barnes and Noble. We do have a couple of books that are published on those sites that we know that you will find very instrumental and that you will find very interesting as well. And the other thing we want to announce is the opening of what we call He Cares CEU Academy. It is an online base um, where you can, if you are a healthcare professional and you need to get some continuous education hour, we offer those to you on that website. And also, we also have the health and wellness coaching. The web address is located there on the screen there. So if you just take a few minutes and go in and check out He Cares CEU Academy. All right. We just want to make those little quick brief announcement before we get into the actual meat of the podcast. And now let's get into the podcast. All right, tonight we are going to be talking about we're going to be talking about the top health concerns for 2025, and what people are worried about the most and why it matters and what we can do about it. This is not just a list of things, but this is real issues shaping lives, the economical system, and our future. So let's go ahead and let's get ready to get into it, okay? All right, the first thing I want to show you here is this diagram here um, of those top 5 health concerns among people today. And they are mental health, chronic disease or non commutable diseases, climate change and health, access to health care, and infectious disease. Now, as you can notice on the screen, they are out of 100. Mental health rates roughly around 90 to 95. Chronic disease or non commutable disease is roughly somewhere between 83, 85. Climate change and health is somewhere between 75 to 77. Access to health care is right at 80. And infectious disease is somewhere around 70, 71, 72. So as you can see, based on this graphic here, that these top 5 public health concerns are very critical to discuss as they are impacting the lives of each and every one of us. So each and every one of us, in some way, shape, form, or fashion, are impacted by these top 5 health concerns. So let's get ready to dive into them and talk about them a little more. All right. So the top public health concerns among people today, as we said, they are 5. They are mental health, chronic disease, access to health care, climate change and health, as well as infectious disease and pandemic threat, future pandemic threat. All right, so first thing we're going to talk about is the mental health crisis. There is a rising in prevalence of mental health crisis. Uh, the young adults and youth are at great risk for mental health illnesses, mental health disease, and mental health crisis. And there are also multiple barriers to treatment for health care. So, like I said, we're going to start off talking about mental health. And it is no surprise that mental health is on the top of this list. As I said, we're seeing a increase or rise in the level of anxiety, depression, and burnout across the board. Most so, particularly with our young people, but it's across the board in general. Okay, and this includes, like I say, the young people, which they're at the top of the list, frontline workers, healthcare workers, firefighters, any kind of frontline workers, um, as well as caregivers, nurses, doctors, social workers. So yeah, mental health issue among these groups is on the rise, and like I say, with the youth being at the top of that list, but everybody in some way, some shape, some form, some fashion are impacted by this mental health crisis. Now, the pandemic may have eased, but the emotional after effect is still very present. Isolation, grief, financial stress, all of that is still going on and affecting places such as clinics, schools, and even in our own private home. But there is one positive shift. Mental health is now actually being put at the forefront and being talked about and being discussed more openly than it has ever been before. There are people that are now going to therapy that probably would not have gone in the past, but they're now starting to go and seek therapy, which is a very good thing. Uh, they're using mental health apps, different type of apps that are available to help with stress reduction, such as mindfulness and things of that nature. And they're also joining and going to support groups. So that is one of the positive things. But we are still in a mental health crisis. Okay, let's see. And there's a growing number or a growing number of misunderstanding that our mental health is not as important as our physical health, which is not true. Our mental health is just as important as our physical health. And in some instance, our mental health actually has an influence and an impact on our physical health. So we're also seeing more integration of mental health in workplaces and school. Like I say, is now being discussed more and talked about more. So a lot of more implementation of training and workshop within schools and in the workplaces, and this is a great thing. But there's still a big gap in access. Access to mental health is there's a big gap there. There's a uh, deficiency in healthcare providers, mental health providers. So that is one of those barriers to the treatment. The inability to have access to mental health care and the lack or the insufficiency in the number and the amount of mental health providers. So, what can we do? We can start with self care. Start with self care. Start taking care of yourself, connecting and checking in on one another. If you know someone is, going through with something or experiencing a hard time or recently experienced a loss or recently experienced some type of tragedy, it's very important that you check in on those individuals because trauma has a way of impacting us that we may not see it or we may not feel it at the time of the occurrence, but later on down the line, it could start flaring back up. There could be a trigger, something that triggers it and makes it surface. And a lot of times, a lot of us suppress things. We suppress a lot of things. And because of that, uh, in the long run, we can have what's called PTSD, post traumatic stress syndrome, where something triggers that event that you had that occurred, something triggers it and brings it back to the surface, and it can have a negative impact on the way that we can physically feel it, can have an impact on us physically. We start having physical symptoms from it. So it's very important that we take time to take care of self care, um, doing mindfulness, taking walks, talking to somebody, going to therapy. So all those things are part of self care, taking care of yourself, making sure you okay. All right. And it said, and if you're struggling, please reach out. Help is there. I think the number is 988. That's the suicide crisis line. You can call that number 988. All right. So let's move on. The second thing we're going to talk about is chronic disease crisis. This is things such as non-communicable diseases. Those chronic diseases such as heart disease, things like diabetes, things like cancer and respiratory distress. These are all part of the chronic disease crisis, or what we call non-communicable diseases. So now these type of chronic diseases, such as I said, heart disease, cancer, diabetes, respiratory disease, they count for over 70% of global mortality. That is a very high number. Even though it's a combination of all of the heart disease, the diabetes, cancer, respiratory disease, and other types of non-communicable disease, but they count for 70% of global mortality. And what that means, what I'm basically saying is count 70% of death globally. So around the globe, these non-communicable disease or these chronic diseases accounts for 70% of death around the globe. Heart disease, diabetes, cancer, and respiratory disease. And the wild part is that many of these diseases are preventable. That's why they're called non-communicable disease. Most of them are preventable with certain things such as life changes. So let's face it, we live in a world or a society where there's bad fast food. Everything is such rush. Everybody's in such a hurry, and so there's hardly no time to cook a good healthy meal. So we go and we grab some fast food, and people become sedentary. Very little type of physical activity going on, such as brisk walking, bicycling, and things such of that nature. And we're living in a high stress world. There's so much uncertainty and so many things that are going on in the world today, and people are just becoming stressed out. That's why I said go back to that first part where we were talking about making sure you do that self-care, take care of yourself. Uh, we have a lot of processed food. We spend a lot of time on our phones, video games. That's part of that sedentary, not being physically active. We just sit there playing games and doing videos and things of that nature. We lack of rest. People are not getting enough sleep. Um, you got your smokers. You got people that does excessive drinking. And notice I said excessive drinking. And we're just stressed out and just you know all types of health issues, all type of health concerns, and all these factor into this chronic disease crisis. And the healthcare is just become so overwhelmed with treating these types of chronic diseases. Like I said, heart disease, diabetes, cancer, respiratory disease. The healthcare system is coming, overwhelmed. The shortage of healthcare providers and all these leads to this increase in the number of chronic disease and making the crisis even uh, much more notable. And so it's very important that we take time and get those preventative type of services, such as getting those mammograms and doing those home self breast exam, and for men's to make sure we're getting that prostate exam done, and doing what we call testicular exams at home. Just like a woman when she does her self breast exam at home, feeling to check to see if there are, any nodules, any bumps, or anything like that. Men can do what's called a testicular exam, to just do the same way. Take your testicles and feel to see if you feel anything abnormal there. And go in and get those colonoscopies done and all those things such as that there to make sure that we get those preventative cares. Go and get those pap smears. It's very important to get these preventative cares because, as I said, these chronic disease or non-communicable disease, a whole lot of them are preventable if we just go ahead and get those preventative screening done as they are recommended by your healthcare provider and as the guidelines for the CDC and things such of that nature. So it's important, as I say, I cannot stress enough the importance of preventative care. Preventative care will help to reduce these numbers or the percentage of chronic disease crisis. Okay? Like I say, prevention starts small. You can start off walking more, eating cleaner and healthier foods, and getting those regular checks up, just like we just discussed. And healthcare needs, to focus not just on treatment, but on education and outreach. That is why we're here, Dr. Willis and I. That's why we have this program, Health Talk. That's why we have uh, developed or started He Cares Training and Education Center, where we can provide you with health information and health education on various health topics to encourage you to get those preventative care, to encourage you to do those monthly checks, to exercise. And when I say exercise, I'm not really talking about going to the gym with those vigorous exercises, the walking, things of such nature, like so that will help to reduce the number of chronic diseases within the place. And also, it's good to have these type of activities in uh, places such as the school, such as your churches. Church holds some health fairs to provide. If you can get some healthcare practitioner come out and do some prostate exam at the health fair, to provide you with education and information at these health fair within places such as within your churches and in your workplace and things of that nature. Education is a critical component to helping combat this chronic disease crisis or these non-communicable disease. Education is the key, and that's what we're here for. That's why we have created also He Cares CEU Academy. We also provide you education there, and also with the health and wellness coaching session. All right. So let's move on now to the next one, which is access to health care. Now, this isn't just a political issue, it is a deeply personal one because there's a lot of people that do not have health insurance. And because they don't have health insurance, they do not go and get those preventative treatment. They do not go and get those preventative screening. So the access to health care, that is one of the crises too. Now, in many parts of the world, people are dying not just because there's no cure, but because they cannot afford care or to reach a provider. So they just simply can't afford it. Thank God for modern technology. We now have telehealth. We now have telemedicine. I just recently obtained my certification as a telehealth presenter. So I'm grateful to God for that He's allowed me to complete that course and receive that certification. So there are ways that are becoming more present to receive access to health care. You have teledocs, you have things of that nature. So the access to health care, even though it is a crisis, there are other avenues that are being created so that you can have access to health care. Now, in rural area, there may not be a doctor for 50 to 100 miles away. But in cities, there might be clinics, but people don't have the insurance, or there's too many hurdles to get through the clinic. So, what's the fix? It's complex. It's a complex fix, but it starts with investing in healthcare infrastructure, expanding coverage, and as we know, there is a shortage in healthcare provider, so also training more healthcare provider. And as I said before, thank God for modern technology that we can do telehealth appointments, telemedicine, and things of that nature. So you may be here in one part of the world and you're able to have access to specialty care in a whole different part of the world as well through telemedicine and telehealth. So that is a blessing, and that will help with this access to health care crisis. But it's important that we take the time and get and invest in health insurance. And I know it's expensive. I know it's challenging, but it's critical that we get this health insurance so that we can, as I stated previously, to get these preventative service, to make sure we're getting these regular checkup so that we will not add to the crisis of those non-communicable diseases. And I said telemedicine, it was a huge help when the pandemic occurred. So a lot of people were still able to receive care even though we was during the pandemic because of telemedicine and telehealth. Uh, it, and it continues on to help bridge this gap to the access in healthcare. All right, so let's move on to the next one. The next one is, and again, we're going to take a few minutes. If you have any questions, any concern, just go ahead and type it into that comment section. Also, take a minute to hit that like, share button so that this information can be put out so that more people can get an understanding and be informed and be educated about these top issues that are globally, not just here in the United States, but these are the top 5 issues that are globally. All right. So back into our topic. The next one is the climate change and health crises. Now let's talk about that for a minute. See, people often think when we talk about climate change, people think about issues with polar bears and ice, ice melting and things of such nature like that. They're melting ice caps, but climate change is hitting our health in a very real way. It's just not about, like we say, the melted ice caps and polar bears, but climate change is affecting our health, and it's doing so in a real way. There's things such as heat waves, uh, wildfires. We know recently the wildfires out in California. We got extreme heat waves. Uh, you know, flooding, flooding taking places that have never experienced or never seen such levels of flooding as they are seeing now. Recently, there was just recently an incident where there was a flooding. I think the people had seen a month of rain within, I think, like within a 12-hour period. They'd seen a whole month, the entire month of rain. So basically, what that is meaning is the amount of rain that they typically receive in 1 month, they saw that amount of rain within 12 hours, which caused flash floodings and things of that nature. So all of this is a part of climate change and how it affects our health. Poor air quality and even mental health trauma. The mental health trauma come from things such as the wildfires, people losing their home, people losing everything that they work so hard for and what they build. So it leads to mental health issues. So you can understand how climate change affects our health, which leads to climate change and health crisis. As I said, with poor health and poor air quality, children that has asthma, you start to see cases of exasperation of those cases of children with asthma or other respiratory type problems. You got seniors that are suffering from heat strokes, and you got a whole community, as I said, that are being displaced by things such as hurricanes and floodings and tsunamis and things of that nature. It is real. So climate change and health crisis, they're hand in hand. It's real and it's here and it's now. You have what we call climate anxiety. It's an ongoing mental health crisis, part of the mental health crisis, but it's fall under the category of climate change because we call it climate anxiety. Basically, what that means is people that have suffered some type of tragic loss, such as flooding or a hurricane or tornado. Whenever those types of events begin to come or alerts be put out about them, you got people that get climate anxiety. They start to get stressful because and start to get anxious because of what they suffered through previous experience. So it is real, it is here, and it's now. So what can we do about it? We need to push for more greener policy. We need to try to reduce emissions from factories and cars and things like that. Start planting more trees, making more greener choices and things like that, preparing our health system for climate change emergency. So it's important that we prepare and help to do our part in helping to decrease or improve climate change. Uh, so it's very important. It's very critical. All right. So next thing we're going to talk about is the infection disease and pandemic crisis. So this is our last topic of the five most common health issues or health concerns that is facing us in 2025 globally. And the last one we're going to talk about here is the infection disease and the pandemic fear crisis. Again, you had any comments, questions, concerns, just go ahead and type it in that comment section and we'll try to get to it as quickly as we possibly can. Also, we encourage you to take a moment to just hit this like, share, and subscribe button. Just so we can get this health information and this health education out to people, that it can be made available so that everyone can have this information and that we can begin to make a difference in our communities. All right, the last thing we're going to talk about, as I said, the infectious disease and pandemic crisis. Now, we can't forget about the recent pandemic that we went through, which was COVID. And this pandemic actually changed the world. And even though we're still adjusting to a new normal, the fear of another pandemic, it lingers. So there's concern of, what's going to be the next pandemic. Um, we got things such as people not wanting to be vaccinated. We got those who, talk against vaccine and have all this misconception and this misinformation being submitted about health, vaccine and what they can do and what they cause. So you got people that have vaccine hesitancy. You got misinformation. You got underfunded public systems, and all these things uh, play into the infectious disease and pandemic fear crisis. And now we have what is, the threat of the bird flu, which is one our current. It's not a pandemic at this time, but it is an infectious disease issue that is currently taking place here in the United States. And it's the threat of the bird flu, or what we call the H5N1. This is causing alarm in both the medical and the agricultural communities. So it is a real thing, it's a real threat, and we need to start looking at it as that, and not just to take it lightly so that it will not catch us off guard. Preferably that it will not reach the level of a pandemic, but there are great concerns among those agricultural communities as well as the healthcare community. All right. The risk of what's called the zoonotic spillover, and this is where disease jump from humans to animals, from animals to humans, rather. Excuse me. It's called the zoonotic spillover, and that's where you have diseases such as the bird flu when it jumps from animal to human. And it is more prevalent than ever, as we noted with the case of bird flu. What's even more concerning is the dismantling of public health infrastructure that's occurring in some regions. So, we got the rise in the bird flu, and now public health infrastructures are being dismantled, and people are being laid off within the CDC, the communication with the World Health Organization. All of these, places provide us with updated information concerning different type of infectious disease or any type of concerns that are taking place across the world. But with the dismantling of these infrastructure, it causes the risk for these infectious disease to increase. Hence, that we are in that fear or in that crisis realm. It's not a crisis yet. We got things such as budget cut, and I talked about. We got staff being laid off, uh, closing of public health departments, and they're just leaving communities vulnerable and unprepared. Global climate, global travel. Excuse me. Goodness. Global travel, climate change, and urbanization means disease can spread faster than ever. And think about now we're dismantling, you know, health structure. So the good news is we now know how to respond a little faster and a little better because the COVID pandemic helped us to prepare for that. But again, it's going to be challenging with the closing and the dismantling of these public health infrastructure. But that only works if we keep the health system funded, trained, and trust. We must restore trust to the health infrastructure. Public health preparedness must be a priority, not just during a crisis, but that must be something that is an ongoing, constant thing to be prepared. All right? So, so there you have it. The 5 public health issues people are most concerned with in 2025. And to recap that, they are mental health. Notice that there's a rise in the rate of anxiety, depression, burnout. The second one is chronic disease, or what we call non-communicable disease, things such as heart disease, diabetes, cancer. And the third one, the access to health care. Talked about cost insurance, health insurance, provider shortages. The fourth one is climate change and health. Talked about the heat wave, the pollution, and things of that nature. And lastly, infection disease and pandemic threat. All right, so there you have it. Our 5 top public health concerns among people today for 2025. We've given you the 5 top ones. So, which one of these resonated with you? Of these 5, which one that resonated the most with you? Was it the mental health? Was it the chronic disease? Was it the access to health care? Maybe it was climate change and health. Or maybe it was infectious disease and pandemic threat. But which one of these resonated with you? What do you think we should focus on as a society? What do you think that we should focus on as a society? We want to hear from you. So, what we would like for you to do, leave us a comment. Type us a message in that comment. We would like you to also take a quick moment to like and share this podcast. Also, if you're watching us on YouTube, please go ahead and subscribe to our channel. It helps us to get this information out to more people and to produce more videos and podcasts such as this here. Also, make sure if you're watching by YouTube, you hit the subscribe, but you also hit that bell so you get notification each time that we upload new content. Okay? So we want to hear from you. Again, leave us a comment. Go ahead, like, share, and if you're watching on YouTube, go ahead and subscribe and make sure you hit that bell to get those notifications when we upload new content. We really appreciate you to the highest. We want you to know that we do thank you. Now, if today's episodes got you thinking, then as I said, share it with a friend. Let's get this information out to as many people as we possibly can. All right? Until next time, make sure you stay healthy and provide yourself some self-care. You take care of yourself, okay? Do it for you. All right? Thank you again so much for joining us here on Health Talk. Dr. Willis and myself, we appreciate you all for the support that you provide us here on Health Talk. It encourages us to continue to move forward. It encourages us to also to continue to provide services such as this to people everywhere, and we are grateful to you. We just want you to know that. Um, so, if you will, like I say, take a moment, hit that like and share button. And if you're watching us on our Health Talk channel on YouTube, please take a minute to go ahead and hit that like, give us a thumb up. Also, go ahead and hit that subscribe button and make sure you hit that bell so that you can get notification that when we upload new material, that you'll receive notification of that new material that has been uploaded. Again, thank you for watching us here on Health Talk. Health Talk is a part of He Cares Training and Education Center, where yours truly, Dr. Corbett, is the program director, and Dr. Deidre Willis is our project manager. And we thank you for taking time to join us here today. All right, until the next time, make sure you hit that like, share button for us, please. It really means a lot to us. And watching us on YouTube, go ahead and hit that thumbs up and hit that subscribe and bell button. All right. Until the next time, God bless you. Stay healthy and take care of yourself. We'll see you in the next video. God bless.